Let's think about when different administration types would be good and some advantages and disadvantages. So we'll start with the IV bolus. And that graph before where I showed you the IV administration, that is a bolus. We're giving it a certain amount of drug all at once. Um, and I'm going to let you think for just a few seconds. When might we use that method of drug administration and what the advantages and disadvantages would be of that? So I'm not going to give you tons of time, but hopefully you were thinking about that um, graph a little bit, or the chart of the drug administration and the concentration. And some examples of where we use an IV bolus is when we need to get something into an animal very quickly. So, to counteract, let's say, sedation, or to uh, give some um, extra fluids to an animal in an emergency situation. We typically give several boluses in different time increments to just get enough fluid in there, but let it be absorbed. And especially when an animal is in critical condition, they usually need more fluid to help support their blood pressure. So that would be an example. So the advantages are it gets in there very fast. We're right into the bloodstream, right? We don't have to mess around with anything else. But the disadvantages are we can get into toxic levels, right? We can get there very quickly. So we need to be careful in giving things as a bolus IV. There's just certain situations when we do it. And bear in mind that some drugs, when we're giving a bolus like that, we need to administer them very slowly. There's some antibiotics that are given during surgery that can cause an animal to vomit. And so, even though we're giving it as a bolus, it doesn't mean that we push the whole thing in immediately. It may mean that we're giving it over a couple of minutes. That's as opposed to an IV infusion. Constant rate infusion is what that CRI stands for. And this is where we would hook an animal up to IV fluids. We put in a catheter, and they have a fluid bag attached with, maybe with a fluid pump. And we're giving something over a long period of time. That would be an animal that needs to have small amounts go in over a long period of time. And it may be a drug that can't be tolerated if it's given too fast. Um, and it would be where we need to have that animal on a medication for a significant amount of time. That's quite often used with a drug called fentanyl. It's an opioid, and that drug has a very short half-life. It's excreted from the body very quickly. So we have to give it with a fluid pump and going in over a very long period of time for it to affect the animal for a long period of time. So IM and sub-Q and oral administration. So IM, we're going to kind of talk about how they are different. So IM administration, if you remember the chart, we've got it's going to take not that long to be absorbed because the muscles are so vascular. Sub-Q and oral administration, it's going to take longer. How much longer? In the instance of IM administration, it may take a few minutes, maybe a half an hour to get into the bloodstream. That's usually about the longest it would take to get in. And then sub-Q and oral, those can take more like an hour, a little bit longer, an hour, a little bit more than an hour. So advantages and disadvantages, well, obviously, if we want to get something into the system sooner, IM is the advantage. On the other hand, those of us administering the IM, giving drugs in the muscle can not always be a pleasant experience to an animal. Sometimes they tolerate it very well, but if it stings at all, that's not usually a pleasant experience. It takes more skill to do that. There are certain places that we do it, and these are all areas that are good muscle areas. We need to avoid nerves when we give these injections. We need to know our anatomy. And uh, so that's the disadvantage, is that it can be painful for the animal. Sub-Q, usually that's easier. Again, it's a poke with the needle. That's going to hurt for just a second, but usually animals tolerate that pretty well. And of course, oral administration can be super easy if you're giving a medication to a Labrador Retriever that will eat just about anything. Could be different to a Chihuahua that is super picky about what they eat and manages to get every pill out of everything that you try to administer it with. So we really have to look at our patient again and look at our client and figure out which is the best for each. We usually think about oral administration for sending home when an animal has to be on a medication for a while. That is really our only option. Some large animal owners and horse owners may be willing to give injections if you teach them how to do that, but usually that's a very you have to be careful in who you're giving those kind of medications to. So oral is usually our way that we get drugs home with our patients so they can be on it for a longer time period. So I didn't mention this before, but now I'm going to mention it. So depending on how we give a drug and what kind of drug we're giving will affect whether it's going to be absorbed well, depending on where we're placing it. So if you remember, we talked about lipophilic and hydrophilic drugs. The lipophilic drugs are fat-loving drugs. They can move across membranes, which are composed of fats by lipid layer membranes. So lipophilic drugs can dissolve across them fairly easily. Hydrophilic drugs won't. Um, And so we're depending upon hydrophilic drugs to go around cells. They're going to be moving in between cells until they reach a capillary, and then they will go into the bloodstream and be distributed. So extracellular, if we're looking for something to move in an extracellular environment, so giving it in the muscle, giving it subcutaneously, that would be hydrophilic because it's going to move through a fluid environment and get to a capillary. So if we want it to stay in a location, we would use a lipophilic drug. This drug, ProHeart 6, it is still out there. It was a heartworm medication that came out, and it's called ProHeart 6 because it would last 6 months. They also had a 12-month version. You basically placed it subcutaneously, and the animal was protected against heartworms for 6 months. It's because it was in a lipophilic form, and it would stay there. It did create some local tissue irritation, and so it has been taken off the market at least once. My fear with it is, you place it in there, it's going to stay in there for 6 months. So if an animal has an adverse reaction, you can't do a whole lot about getting it back out. It was never my favorite one. The main advantage was owner compliance, one visit to the veterinarian every 6 months, and the animal was good to go. So let's talk about drugs that are administered orally. Which one do you think would be best to be absorbed from the GI tract? So drugs that are absorbed from the GI tract have to move through the mucosal lining and the gastrointestinal cells. So we need something to move through a cell membrane. So in that case, we are looking for lipophilic. As a reminder, so lipophilic drugs will move across the gastrointestinal membrane easily and get into the systemic circulation. So if you remember, we also talked about ionized or polarized and non-ionized or non-polarized. And each of those two things on either side of that big OR, capitalized OR, are the same types of drugs. So highly ionized or polarized, those are our hydrophilic drugs. Non-ionized or non-polarized are our lipophilic drugs. So the hydrophilic ones are poorly absorbed from the GI tract. Drugs that we are giving orally that are hydrophilic are usually intended to stay in the gastrointestinal tract, treating parasites or inflammation in the gastrointestinal tract. Okay, and so this is just a little graphic of hydrophilic drugs. They move in between the cells. Eventually, they get to a capillary and go into the systemic circulation. Lipophilic drugs, this is the place where we want them to be absorbed. It's in the intestinal lumen. They're going to have to move across these intestinal cells, which they can readily do because they can move through cell membranes easily. The other thing that happens is we have to look at the environment in which we place a particular drug. Drugs can be acidic or alkaline. If you remember your pH, acidic is a low pH, and that just means that it has more hydrogen ions to donate. That's kind of the capital H of the pH scale. And alkaline means that it will take up hydrogen ions in an appropriate environment. So what happens, though, to a particular drug is it can change its form between hydrophilic and lipophilic depending on what environment we place it in. And so we have different environments in the stomach and the duodenum, or the beginning of the small intestine. And there's a concept called pKa. pKa is the pH of the environment in which a particular drug will be half lipophilic and half hydrophilic. So again, the environment in which a particular drug is placed will affect which form it takes and whether it may be absorbed in a particular environment or not absorbed in that environment. So aspirin, we're going to give this example in the stomach, in the gastric environment. So that's the stomach. Its pKa is 3, and that happens to be the pH that many stomachs are at. It's the pH of 3. At that pH, half of the aspirin is ionized, which is represented by the pluses, and half is non-ionized. So that is the definition of the pKa, the pH at which a drug, when it's placed in that environment, is half ionized and half non-ionized, half lipophilic and half hydrophilic. As that aspirin moves into the duodenum, the pH becomes more alkaline, more toward the alkaline scale. It may be more in the 6 and 7 range. We're saying pH 5 here. It's definitely more alkaline. And as you can see, more of the aspirin in this environment becomes ionized. Ionized equals hydrophilic. Although in the stomach we don't have a predominance of non-ionized, we have more than we do in the duodenum. So aspirin is going to be absorbed better in the stomach and less well in the duodenum. So this is just basically stating that. So we have more aspirin is more readily absorbed because it is in the form that can be absorbed across the cell membranes. And when it moves to the duodenum, it changes its form so that it's hydrophilic and is not absorbed well. So the strength of a particular drug, whether it is a strong acid or a strong alkaline drug, also has an influence on whether that drug will change forms. When we have a very strong acid or a very strong alkaline drug, they do not tend to be as affected by the pHs that we have in the body, the physiologic pHs. So we're typically dealing with weak acids and weak alkalines when we're administering drugs, and they will change their form when they're administered orally or depending on where they end up in the body. So the bottom line, non-ionized equals lipophilic. That is good for being absorbed across a cell membrane, and so we typically use those types of drugs for oral administration. Ionized drugs are hydrophilic, and they typically are used in IM and sub-Q drug administration.